before I'm hand hygiene, before I went in, hi, my name's Becky, I'm going to be your student nurse today. I would start by having my patient void prior to the start of the assessment. I would then instruct her to please bend your knees just throughout the assessment, especially if she was experiencing any abdominal pain. So first I'm going to start by inspecting the contour of her abdomen. It's flat, it's not any protruding abnormalities, and it's important to do this at eye level. Then I'm going to inspect for any striae or stretch marks, any scars, any lesions, any cuts, burns, bruises, tattoos, and piercings. Also, especially for males, if there was hair distribution, I would make sure that it is symmetrical. So now I'm going to begin my auscultation. I'm going to start by auscultating the bowel sounds within the 4 abdominal quadrants. And for this, I'm going to use the diaphragm of my stethoscope. And it's important to do auscultation before you palpate, especially because with palpation, you want to do the most tender areas last. So if you pick up an abnormality upon auscultation, that could determine the order of your palpation. So I'm going to start in the right lower quadrant, and I'm going to go in a clockwise motion. So I would listen here, 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 and here. And then now I'm going to use the bell of my stethoscope, and I'm going to be auscultating in 7 positions. And here I'm looking for the vascular sounds, and I'm going to be noting any abnormalities. So I'm going to start with the femoral artery, again using the bell of my stethoscope. So I would start with the femoral, then I would go to the iliac, then to the renal, then to the abdominal aorta, back to the renal, the iliac, and then the femoral. And then next I would begin my percussion. So I'm again going to percuss within the 4 abdominal quadrants. So I would start with the right lower, and I would expect to hear a resonant sound. A hyperresonant sound can indicate gas, and a dull sound is heard over any organs, but it can also be heard over any tumors or masses where organs aren't supposed to be present. And lastly, for percussion, can I have you just sit up and have your feet on the floor here, facing this way? I'm going to percuss the costa vertebral angle, and if she feels any pain upon percussion, this can be an indication of a kidney infection. So I'm going to place my hand right here, percuss there, and the same on the following side. And my hand is also going over her kidneys. So you can sit back for me, thank you. So then I'm going to begin my palpation. I'm going to start with light palpation, and then I'm going to go to deep palpation. So I would first use one hand for light, again assessing the 4 quadrants, and I would then go to a deep palpation, noting any pain, any abnormalities such as asymmetry, or any tenderness or masses. And then lastly, I would do the 2 signs. I would do Murphy's sign, which assesses any issues with the gallbladder. So I'm going to have you take a breath in. I would push on the liver, then you can breathe out and release. If she reported any pain, that could indicate something with her gallbladder. And then I'm going to do the Bloomberg sign. So I would press straight into the abdomen and straight out. If the patient felt any pain upon rebound or rebound pain, this could be an indication of appendicitis, especially if this pain is felt in the right lower quadrant. And that is it for the abdominal assessment.